Hi. Medical devices are becoming more and more connected. They're more connected to each other. They're more connected to the hospital's networks. They're more connected to patients' smartphones, and they're more connected to the internet. It's estimated that 1 out of every 4 medical devices is now connected. If you were to go to the hospital today, it's estimated that you would encounter 10 medical devices during your visit. It's because of this increased connectedness of medical devices that hackers are starting to target medical devices. Now, when I say hackers are targeting medical devices, everyone always immediately jumps to the assumption that hackers are trying to hurt you through your medical devices. So while I won't say it's not possible, it actually is. What I will say is, in general, there are easier ways to hurt people than through their medical device. So take, for example, a pacemaker. This is something that people often think of when they're thinking of a medical device harming someone. If I wanted to change the configuration or the codes on your pacemaker, I would have to stand right next to you. I would have to hold specialized electronic equipment up to your chest for several minutes. That's really not the type of thing you can do to someone without them noticing. And it's not what we call a remote or scalable attack. So it's not remote in the sense that an attacker can't do it from the comfort of their couch, and it's not scalable because they can't use it to simultaneously hurt numerous people. So attackers generally want remote and scalable attacks. So for your average person, this isn't a threat you need to worry about. But that being said, former Vice President Dick Cheney did have the wireless connectivity to his pacemaker disabled because for him, it was potentially a realistic threat. So if attackers aren't trying to hurt you through your medical device, why are they attacking medical devices? Well, it seems like every week we hear about some new cybersecurity breach that affects individuals. We all heard about Target, the DMV, and I'm sure there's a number of you in this room that those affected. But what you may not know is that last year, 67% of the identity records breached in the United States happened in healthcare. Today, on the black market, your credit card number is worth only about $2, where your electronic health record is worth anywhere from 10 to 20. So why the big difference? Well, if you were to notice a fraudulent charge on your credit card today, you could have the charge reversed, the card closed, and a new card in your hand in a matter of days. It's really not that big of an inconvenience. But your electronic health record, that has not only your credit card number, but your address, your social security number, your employer, and your insurance information. So with that kind of information, I could use the credit card number, but I could also open new credit cards in your name. I could potentially take out a bank loan. I could get high-priced narcotics on your medical insurance. So how do you protect against that? How do you change your name, your address, your employer? Well, you can't, and that's what makes that information so much more valuable. So we've talked about hackers going after medical devices, but there's actually another category of cyber harm that we see more commonly, and it's accidental cyber harm. A lot of cybersecurity is just making a system robust to the unknown or the unexpected. Malice is not always a prerequisite for harm. So take, for example, something that happened earlier this year. There was a medical device that's used in a heart procedure that became unresponsive and unusable mid-heart procedure. Now, later after investigation, it was found that what happened was the antivirus software running on this system started to run mid-heart procedure. And in doing so, it locked up access to data that the medical device needed in order to operate. So the device became unresponsive. But think about that. Antivirus software's sole purpose for existence is to stop malicious things from happening on a system. So while that antivirus was trying to stop something malicious from happening, it accidentally did something malicious. No malice intended. Now, in this particular case, the doctors were able to get the device back up and running while the patient was still sedated and finish the surgery. But it's so easy to imagine how this could have gone so much worse. Or another example that happened last year. A nurse plugged her cell phone into one of the USB ports on the front of an anesthesia machine trying to charge her phone. When she did that, the anesthesia machine shut down. Now I know you're thinking, Why would you plug your cell phone into an anesthesia machine? We probably shouldn't do that. And while I agree with you, we've all been in those situations where our cell phone is about to die. We either need to make a call or we're expecting one, and you're looking around desperately trying to find somewhere to plug in to charge. Now that nurse, there was no malice there. She was simply looking for somewhere to plug in her phone. And in that case, the anesthesia machine was not in use, so nobody was harmed. But again, malice is not a prerequisite for harm. That system was not robust to the unknown or the unexpected. So who am I and why am I here talking to you about this? Well, my name's Stephanie. I'm an ethical hacker, and I'm here to help. So what is an ethical hacker? Well, ethical hackers are people who study hacking, we practice hacking, and then yes, we hack stuff. But only to test the defenses of that system and only in approved circumstances. But what am I specifically doing? Well, my job is to work with medical product manufacturers to help them design medical devices worthy of our trust. The best way to make a system secure is to design it in from the beginning. Cybersecurity is not simply a feature we can add to a system, it's actually an emergent property of a well-designed system. A lot of cybersecurity, recall, is making things robust to the unknown or the unexpected. So take, for example, an inhaler system I've been working on. This inhaler system has a Bluetooth connection to the patient's smartphone, so the patient can monitor how many doses they have remaining in their inhaler. Now, that Bluetooth connection is a threat to that device. An attacker could try to manipulate or steal information from you through that Bluetooth connection. So at design time, we said, well, we do have a need to send data out over Bluetooth, but we don't really have a need to take any data back. So we made the conscious decision at design time to simply not accept any incoming data over Bluetooth. By doing that, we made ourselves resilient to any known Bluetooth attacks and any future ones, robust to the unknown or the unexpected. But what if you're past design time? So you have a physical device. It's either a prototype device or a medical device that's already out in the field. Well then, that's when we try to hack it. We're going to try to hack into it, see how can we get into it. Once we're into it, what can we change? What can I access? What can I manipulate? Having an ethical hacker attack your device is a great way to test its defenses. They're going to tell you what type of attacks they tried, what worked, they'll offer you advice on how to make it better, and they'll do it all under safe circumstances when it's not hooked up to a patient and it's not hooked up to the hospital network. So take for example, that anesthesia machine I talked about earlier that couldn't handle a cell phone connection. That's the type of thing that could have come up in cybersecurity testing, and then we would have made conscious decisions of what to do. So maybe we would have decided there's really no need for us to accept cell phone connections, and if we saw one, we'd simply reject the connection. Or maybe we would have decided to gracefully handle it, but we would have handled it in a manner that was safe. Now, I don't want to leave you with the impression that connected medical devices are all doom and gloom. The truth is, connected medical devices allow us to provide a better quality of patient care. If I were to suddenly have a need for unique surgery, a surgical specialist halfway across the world could either assist in the procedure or perform it. When I'm in the hospital recovering, the connected medical devices that are monitoring me are able to allow my caregivers to see a real-time picture of how I'm doing. So if something starts to go wrong in my recovery, they know right away. When I'm out of the hospital, my electronic health record can help look for potential drug interactions for prescriptions I may fill at different pharmacies. Connected medical devices like pacemakers allow someone who may have lived a very dependent life to now live an independent one. That connected pacemaker can now potentially call for help if that patient becomes unresponsive. Think of a diabetic child who's able to go to her very first sleepover because she now has a connected insulin pump that allows her parents to remotely monitor her glucose levels and deliver insulin if she needs it. I feel confident in saying that the benefit of connected medical devices outweighs the risks, and myself and other ethical hackers are working really hard to make sure that the connected medical devices out there are worthy of our trust. Thank you.